Welcome back, everybody, to another episode of the Mission Brain podcast. I'm your future favorite host, Ali, and I'm joined today by Dr. Ernest J. Barthélemy. Dr. Barthélemy was born in Brooklyn and is proudly Haitian American with deep roots in Haiti. He trained in neurosurgery at Mount Sinai and completed advanced fellowship training at UCSF with a focus on neurotrauma and global surgery. Today, Dr. Barthélemy serves as a neurosurgeon and a faculty leader at SUNY Downstate and One Brooklyn Health in New York. And he's also serving as the president of the American Society of Black Neurosurgeons. In this episode, we're going to talk about leadership. We're going to talk about Dr. Barthélemy's work in building real pipelines and what equity in neurosurgery looks like. Thank you, Dr. Barthélemy. Welcome to the show.
Sure. Thanks for having me back. This is always a pleasure. So
Fantastic.
Let's get into it.
Fantastic. Yeah. Let's get to our first question, Dr. Barthélemy. Sure. What's your origin story?
Oh, my origin story. Well, it changes every time I get questions like that. So my origin story today is that, as you mentioned, I'm a son of Haitian immigrants. Okay. And so I call myself the first American in our family because I'm the first person who was born in the US. I'm bicultural that way. Professionally, obviously, I'm here as a neurosurgeon representing neurosurgery, global neurosurgery. And I had a very non-traditional path into medicine and neurosurgery. So medicine and neurosurgery are actually my third career. I had a career as a professional dancer, is a little known fact about me out, within the medical circles. And I was an Afro-Cuban and Latin dancer for several years. And what was interesting about that, and I sort of view my movement through the various hats I've worn, is that it informed what I'm up to today in global health, because I used that background in African and Latin American cultural and historical studies that supported what I was doing as an artist, and really leaned into that when I transitioned several years later into global neurosurgery to try and understand why there was a profound lack of access to neurosurgical care in Haiti, where both of my parents are from. So I think I'll pause there today, and hearing you talk about what we'd like to focus on. I will say that the opportunity to lead the American Society of Black Neurosurgeons in many ways is the manifestation or the realization of everything I'm standing for in terms of health equity and decoloniality, which for me is an important part of that health equity conversation.
Amazing. Dr. Barthélemy, you mentioned two things that I want to touch upon here. You mentioned your switch in career, so we want to understand, and our audience wants to understand, how did those several parts of your career, being a dancer, being one of them, lead to you now becoming a neurosurgeon? And yeah, go ahead.
Yeah, and you said, did you have another one? Or you want me to go ahead and
there's another one. So, and now, after becoming a neurosurgeon, when did you realize that your work had to extend beyond the OR, and that was there a calling that you had to go back and serve this community? And now you serving as a president, how has it been?
Yeah, very good. Okay, so let's take the first one. So I told you the first career, I didn't tell you the second one. And the second one was I was a personal fitness trainer. Okay. And so I remember I was at a dance festival that I think in our dance circles is considered to be sort of a prestigious one. So I was sort of at the, coming into the height of my career as an Afro-Cuban and African and Latin dancer. And then I injured my knee pretty badly in a class in that dance, sort of that dance intensive experience in the Berkshires many years ago. And so I was searching for how to continue to, basically express my passion for physical culture, but in a safer way, in a way where I was less likely to injure myself. And that's what prompted the transition from my personal training, my dance career into my personal training career. Okay. So I became a personal fitness trainer. And I didn't really have much of a formal education around exercise science yet at that point. I'd had my dance experience. I'd had an experience in martial arts. I have a black belt in Kung Fu, so I'd spent about 20 years, as a martial artist, and that certainly influenced the direction into this exercise science oriented career. But I needed an education in exercise science, so I pursued a master's degree at Columbia University in applied exercise physiology and motor control. That's around the time when I really fell in love with the brain and the human nervous system. It was actually in the course of studying exercise science that was sort of an unexpected outcome of that moment. And I encountered a mentor who thought I was sort of an odd bird in that program. And he said, you shouldn't be trying to be a fitness trainer to the stars. You should go to medical school and become a physician. And he said, you could still pursue your entrepreneurial aspirations in fitness if you want to as a physician. But then he said it would open up, so many other possibilities for me worldwide. To your sex, so that's sort of what happened, kind of moving through life and making choices based on what was in front of me, where my passion lived, and pursuing them. I want to correct an assumption in your second question that I became a neurosurgeon before I developed my interest in global health. It was quite the other way around. I was certainly inspired into neurosurgery. Before I started medical school, I had read Ben Carson's book, Gifted Hands. And what inspired me about that book is I thought, hey, this guy kind of looks like me. I mean, he actually looks like my father, right? And he literally looked like my father. And I thought, regardless of the things he ended up doing later, political decisions and choices he made with which I don't agree, I was nonetheless deeply inspired by his journey into becoming a prominent Black neurosurgeon in the US, and it convinced me that maybe that was something that I could do as well. And so I moved through the spaces of getting myself into medical school and exploring neurosurgery as a potential career path, but I was open to anything neuroscience related. And one of the things that made the difference for me was in 2010, there was this massive earthquake in Haiti. I had family that died in that earthquake. It profoundly impacted my community. And so I sought to be of service during that moment. And given that I was showing up as a Haitian American, bicultural, bilingual medical student, thinking about my career, but looking to be of service to my parents' home country, I was thinking about, do people in Haiti need neurosurgery? And if they do, what do they need neurosurgery for? And, do they have access to neurosurgery if they need it? So for me, it's just sort of very basic human questions while we were in this moment of humanitarian crisis, trying to respond to major needs in healthcare and the various resource gaps in healthcare in Haiti. I was there as a medical student, not yet decided about what I was going to do in my post-medical school career, but asking questions about neurosurgery in my parents' home country, which, many people would have considered and probably still consider to be the quote unquote poorest country in the Western Hemisphere, right? And so by accident of birth, by the accident of having been born in the United States, and then asking questions about this other deeply impoverished country that I happen to have cultural ties to, I learned that the questions I was asking were questions of global health and global surgery. And so that gave me a new vision for who I might become as a neurosurgeon. And so it was really developing a passion for global neurosurgery inside of a health equity vision. The idea that no Haitian person who needs a neurosurgeon should go without access to that care. That's what drove me to become a neurosurgeon. And so it has been a global neurosurgery journey for me, from soup to nuts, as they say. It's always been about that. That's just the kind of neurosurgeon I sought to become from the beginning.
That's amazing, Dr. Barthélemy. And I see this as a unique journey, which is so multifaceted, and it's so inspiring to see. And I'll just take you on those points as well. You mentioned before as well, you want to take this step towards decolonizing and providing equitable futures. And you currently serve as the president of the American Society of Black Neurosurgeons, which in itself wants to forward that mission and forward that goal. I just want to take a follow-up question on that. How do you feel
Sure.
about the landscape of global neurosurgery, and what do you think, as your role as president, are the next 2 or 3 things right up top that you want to work on the next 5 to 10 years?
Yeah, great questions. Um, I think global neurosurgery has had a lot of wins. And, the wins that I've seen include the growing professionalization of the field, where people recognize there is serious research to be done. There are serious clinical challenges to take on. And we have formally grounded the pursuit of global neurosurgery in a public health framework. And I think that's very useful for people because when people try to define, it's a lot easier for people to understand, this area of surgery is about clipping aneurysms in the brain, or it's about removing, cancer from the brain, etc. Okay. So sort of the clinical subspecialties of neurosurgery, complex spine, deformity correction, things like this. People can understand that. It's a little bit more tangible. But when you get into something like global neurosurgery, one of the challenges is, first of all, it's inherently cross-disciplinary. Okay. And I think what that ends up doing is it kind of puts you at risk of either oversimplifying what this is about. And so there can be a lot of sort of talk and excitement about it, but no one really understands what we're talking about. Or, on the other end, you can realize the depth and breadth of what we're dealing with, and that can be overwhelming at times. So where do you focus, when you really get into it? Are you going to be an epidemiology researcher as a global neurosurgery scholar? Are you going to focus on policy advocacy? Right? Are you going to focus on education and capacity building? Where are you even going to focus? Questions like this. And I think increasingly we're getting better at dealing at the latter end of the spectrum. And I think that's very important, right? And so people, for instance, who have an interest in global neurosurgery research, recognize that there's a lot of serious research to be done. And you can do this as a physician scientist, who your science is the science of global health and global health equity, and you're addressing, this particular aspect of the field. So I think there are more international conversations happening about what global neurosurgery is, what it should look like. And then I'll use this to sort of move into the aspect of your question that touches on the American Society of Black Neurosurgeons. The privilege to serve as president, I think, came from their initial invitation for me to lead the ASBN Global Neurosurgery Committee. I think we were able to pull off some really interesting engagement through that committee that that the board, I think, felt was very useful to the mission of the entire organization. Okay. So in terms of ASBN, and you mentioned 2 or 3 things, and I will say that I am very much committed to using the platform of ASBN to both directly deliver on the mission of the organization to advance the equity and integrity of neurosurgical care, and to really advocate for the Black neurosurgeon, period. Okay. And that's not just in the US, that's globally, right? And we can even talk about what that means if you're interested. What does that mean, the Black neurosurgeon?
Of course.
So we'll get into that. So the global neurosurgery work actually synergizes beautifully with the original intention of the organization. Global health, as we know in the discipline of global health, is not global by location. It's global by the scope of the problems that we take on and the prospective solutions, right? We're dealing with global health issues wherever we are. They are global because they exist everywhere, including in very major ways in the United States. And There are many Black and brown and otherwise under-resourced communities in the US that are dealing with being on the losing end of the colonial legacy, just like under-resourced communities in Latin America and in Africa and in Asia and South Asia in particular. Okay, and so ASBN does provide a platform for dealing with global neurosurgery issues as they impact the US. And that's one of my goals, is to advance that mission with integrity as a global neurosurgery initiative. That said, there are a couple of specific global neurosurgery initiatives that we are working on in ASBN, right? And we're always looking around to see how to partner with other organizations like Mission Brain, like the various global neurosurgery committees of other organized neurosurgery organizations, to make sure that we are, working in a mutually supportive way with our partners. That said, we have a particular interest in our African colleagues. We're deeply, historically and genetically and culturally tied to our neurosurgery colleagues in Africa. So we are actually right now, ASBN right now, is in the process of drafting a memorandum of understanding with CONS. CONS is the Continental Association of African Neurosurgical Societies, the basis of which is to actually look at how we can empower bilaterally supportive and constructive collaborations between the American neurosurgeons of ASBN and our African neurosurgeon counterparts in CONS. And the essence of this MOU is profoundly decolonial, because we're talking about two groups of people and professionals and neurosurgeons who have been palpably impacted by the colonial legacy and are standing up to write a different story, a new story, right? And so this is a very, powerful and I'd say unique moment in global neurosurgery, where you have African neurosurgeons supporting African neurosurgeons, right? So this is what's happening with this ASBN CONS memorandum of understanding. And the last thing I'll speak to is within that MOU, in terms of research, we are working on an initiative called PanBrain, which seeks to create a data resource that supports the advancement of knowledge and the improvement of outcomes in neurosurgical diseases that disproportionately impact African and Afro-descendant communities. So it is a Pan-African Global Neurosurgery Initiative. PanBrain stands for the Pan-African Neurosurgical Biobank and Registry for Acquired Injury and Neurodegeneration. So that will be one of the research initiatives, among others, that we will seek to prioritize in this MOU between ASBN and CONS.
Amazing, Dr. Barthélemy, that is so inspiring to hear. And I'm very excited, and I'm sure our audience will be very excited to see that memorandum come into effect and to see that collaboration have such a positive impact that it sets up to have. But it's so interesting to hear the goals of the ESPN. It's such a valuable organization, and your work is valued across continents. We are all aware of that. But there's a very interesting thing I want you to, I'm just going to cycle you back on that. You mentioned advocating for the Black neurosurgeon, and I'm sure our listeners and viewers want to hear more about that. What's the Black neurosurgeon?
Yeah, great question. Because this actually required, and what I'm going to do is directly paraphrase an interaction I had with the leadership of CONS just yesterday, because I realized that any term that we use to racially classify people has essentially no biological basis. These are purely social and historical phenomenon. And one of the things I explained to the current president of CONS is I took an example. I thought the example would drive it home. I said the term Black in the US is actually the term used to broadly refer to people of African descent. It's used very, very broadly. And there are some salient exceptions, right? I think in general, a white South African would probably not consider themselves Black for very important reasons. because that term has its own, being Black has its own socio-historical basis in South Africa, which is distinct, from that of the US, although related, right? For instance, in South Africa, I found someone referred to me as colored, and I didn't even understand, immediately what that was and how that was different from being Black. So I realized I was in a different culture that required a different education, right? And I went to get that. So I think understanding the term Black in ASBN requires you to understand that, well, the A in ASBN is American, right? So we are referring to what it means to be Black in America, in the United States. And I think the very useful education that came through in our conversation with cons was for them to understand that if they're looking for neurosurgeons of African descent in the US, then who they're looking for is the Black neurosurgeons. That's actually who we are. That's what that term means. It comes from a history of slavery and discrimination and segregation, over the course of the past 400 and more years in the US, that we've made great progress on dismantling in terms of the racism and discrimination aspects of it. But we have a long way to go, I think, as anyone will attest. There's still a lot to be done here. And in neurosurgery, you can see that just by virtue of the, for instance, vastly underrepresented number of neurosurgeons who identify as Black. It's about 4% of neurosurgeons that identify as Black in the US, despite that our population is about 13 to 14% Black in the US. Okay, whereas if you look at other groups, self-identifying white and Asian neurosurgeons tend to be overrepresented as compared to the proportion of the population they represent. And this is important because Black Americans, and this is documented across disease entities, not just in neurosurgery, the health of Black Americans tends to fare better when their physicians look like them, when their physicians are Black. Yeah. And so that kind of provider-patient concordance is very important. And it's an important area, among others, for us to look at when we're trying to address the health equity mission in this country, because Black Americans do, unfortunately, continue to suffer substandard and worse outcomes across the board, certainly across every area of neurological disease you can think of, neurosurgical disease, and beyond, cardiac, metabolic, etc. Okay, and so this is one of the reasons among many that we stand for the increase in Black neurosurgeon representation in ASBN. And the exchange I will paraphrase from my conversation with the cons folks yesterday is I work with a very dear colleague and friend of mine, a trauma surgeon who's Egyptian, and I told the cons leader I was speaking to that this particular Egyptian, by skin color, is actually more fair than the current cons president, who's Moroccan. Okay, I asked my Egyptian trauma surgeon friend, how does he identify? And he says, "Oh, I'm Black." And I said, "Oh," and he got it immediately. The cons representative got it immediately. He understood. He said, "Yeah, this is an Egyptian man who has lived his life in the U.S., has acculturated to the language that we use for talking about people and where they're from, and who has strongly identified with his African heritage, dealt with the brands of discrimination that he's dealt with, and has actually felt most at home with that self-identification because, he is an African American with roots in Egypt."
Amazing. And I just want to add up on that, Barthélemy. It's so
Sure.
powerful to hear this story of being it's so culturally rooted, and how global neurosurgery can also be an agent of social change and of social empowerment. And we're very impressed to see your work, and we're very proud of it at Mission Brain as well. And I just want to, nail home with a final question, and we're going to end after this. A lot of our audience is medical students. Is a lot of guys who are working towards into moving into positions in their career where they'll be part of these change policy making and being an agent of change, right? So, what's your message to, let's say, a 20-year-old or 22-year-old who's in these areas, who's in these communities, from be it the US, as you said, global neurosurgery is not about geographic location, it's about the scope of it. How should they see it, and what's your advice to them?
Yeah. Yeah. Well, Well, for one thing, I would say that the there's a there's a sense of idealism and a passion for social justice that often emerges at the medical school stage, right? Um, my first piece of advice is never lose that. Don't ever, ever lose that. Hold on to that dearly. And as you define your um, career trajectory, let that passion for social justice, for leaving the world in a better condition than it was when you arrived, let that live at the heart of what you do. And if you let that be your guiding light, and you're interested in global neurosurgery, you can't go wrong because now you are fundamentally operating the from the nucleus of health equity, right? Which is a profoundly human um, and humanist endeavor. So that's the first thing I would say. And the second thing I would say is, uh, care about the leadership development. So leadership development, I see as many things: a discipline, a way of life. It doesn't mean being the authority figure. We can all think of many authority figures who are terrible leaders or just very lacking in leadership, right? The development of leadership is really more about becoming a powerful listener, learning how to connect powerfully with others to achieve a common goal, and being able to identify barriers in your self-expression and that get in the way of your ability to effectively work with others towards a common goal. There's no one course that takes someone who is okay. I'll
Oh,
I'll
you're back.
pause until.
You're
Are
back.
you? Am
Yeah.
I back? Okay. What was
Yes.
the last thing you heard me say? Because I saw that we were frozen for a
So,
bit.
so we were talking about having that passion and taking it forward into what we do.
Okay, good. Yeah, this my second comments, I'll try to keep them more succinct, is care about leadership development. Um, you're developing yourself as a leader, which has everything to do with developing your communication skills, becoming a powerful listener, listening to those around you, um, and and learning how to arrive at a common goal and to work with others towards a common goal. This is vitally important in global neurosurgery. And last piece of advice is, again, if you do care about global neurosurgery, then care about public health because you are now dealing in one of the realms where we are looking at how neurosurgery and neurosurgical concerns affect public health and global public health profoundly in all the various ways in which they do. Right? TBI is a silent pandemic. It's the number one reason in the world why people need a neurosurgeon. Stroke has become a neurosurgical disease, and its impact is profound on a public health basis. And if you're interested in global neurosurgery, care about these conditions as well as the cancers and the other things that we care about very much in neurosurgery, but that may not affect as many people, nationally and globally as the first two conditions I mentioned. So that'd be my advice for now.
Thank you so much, Dr. Barthélemy. Thank you for being on our show. And I loved hearing your story. I loved hearing about your goals in the future, and I'm sure our audience will do so as well. I'll just close up with, and I'll quote you here. And this is a message for our audience: is that let that passion live at the heart of what you do. And I think that should be the title of our episode. And with that, I'd like to close. Thank you so much, Dr. Bartholomew. And this episode will be out for you to see as well. So we'll see you soon.
Okay, very good. Thanks for the invitation. Great
Thank
spending
you
time
so
with you
much.
today.
Thank you, sir.
Take care.
Have a good
Bye-bye.
day. Goodbye.